Okay, so this is the part of the musculoskeletal system. We're going to give a focus, trace out the musculoskeletal disease. In this section, we are going to talk about osteoarthritis and rheumatoid arthritis, compare and contrast. We also will talk about the osteoporosis and also the gout, right? All of the disease section. So let's continue first the rheumatoid arthritis, right? Rheumatoid arthritis basically, this is the disease frequently attack the patient who age is 20 to 25 years old. Okay, this is the disease frequently attack if anybody have any underlying cause. So rheumatoid arthritis is a chronic systemic inflammatory disease. Chronic systemic inflammatory disease. Okay, chronic systemic. Chronic means long term. System involved. Inflammation occur. The cause may related to combination of environmental or genetic. Sometimes the disease is carried through the gene, transmitted from family. Another is the environmental. What does it mean, environmental? Maybe you had a defect in your body because of the environmental factor, the disease is started, like stress, anxiety, infection, trauma. They are precipitating factor what is accelerate the disease, right? Rheumatoid arthritis leads to destruction of the connective tissue and synovial membrane within the joint. So you know the joint, two bones are put together through a ligament, tendon, and in between the joint there are some fluid. It's called synovial fluid, and synovial fluid covered by synovial membrane. So osteoarthritis, inflammation of the joint, inflammation of the synovial membrane, and destruction occur in synovial membrane and other connective tissue. What is connective tissue? Connective tissue are the bones, blood, right? All of tendon, ligament, all are connective tissues. Rheumatoid arthritis weaken the joint, lead to dislocation and permanent deformity. Dislocation, displacement, or deformity. Like this picture, you can see deformed and dislocation of the joint. What else? So exacerbation of the disease manifest occur during the period of physical or environmental stress or fatigue. Vasculitis vasculitis mean inflammation of the small arteries, can impede the blood flow, lead to organ or organ system malfunction and failure because of tissue ischemia, right? Every sentence is very interesting, right? Very informative about the rheumatoid arthritis. What we learn basically from here? We learn rheumatoid arthritis are the inflammatory disease process, inflammation, and also pain. Usually patient complain of the pain after rest or immobility. And patient get better with the movement, right? And also I said the bones deformity is most common. And if we check, we can laboratory test or check, we will get the positive rheumatoid factor. Positive rheumatoid factor should be positive in case of rheumatoid arthritis. What next? Some sign and symptom of the disease. Okay, data collection. Keep in mind that rheumatoid arthritis is a systemic disorder. The etiology, unknown cause with exacerbation and remission. Exacerbation means acute condition. Remission means relapse of the disease. This inflammation can affect of the small joint of the hand, wrist, and feet. Morning sickness is most common, and pain associated with activities. As I told you, pain after rest or immobilities, but pain get better with movement. So this is the data: inflammatory change, redness, tenderness, swelling, stiffness. Moderate to severe pain, morning sickness, lasting longer than 30 minutes, right? So this is the morning sickness or pain get better with movement. This nature is just opposite osteoarthritis. Osteoarthritis, basically pain increase with activities. Opposite, I said. Joint deformities, muscle atrophy, decrease the range of motion in affected joint. Also, patient feel low-grade temperature because inflammatory change occur. Fatigue, weakness, anorexia, weight loss, and anemia developed. If you check the ESR or elevated the sedimentation rate or positive rheumatoid factor. Rheumatoid factor, if positive, it indicates patient has diagnosed by rheumatoid arthritis. Okay. Also, sometimes we can take the synovial tissue for biopsy. The rheumatoid factor for this disease. A blood test used to assist in the diagnosing the rheumatoid arthritis. So rheumatoid factor is a protein. Usually it would be positive in rheumatoid arthritis. Okay. So what are the treatment for rheumatoid arthritis? The treatment, we use the aspirin or we use the NSAID or steroid. Combination of the pharmacological therapy combination, including non-steroidal anti-inflammatory, disease-modifying anti-rheumatoid drugs, and glucocorticoid, means steroid, right? And disease modifying agents, basically we use hydrochloroquine or adalimumab. Adalimumab is immunosuppressive agent like alemtuzumab, mebendazumab, but adalimumab we use for combination therapy. Okay, but keep in mind this combination therapy has some side effect. Okay, so what next? Here, rheumatoid arthritis, physical mobilities. Here, usually patient preserve joint function, provide the range of motion exercise to maintain joint motion and muscle strengthening. Balance, rest, and activities. Very important. As I told at the beginning, rheumatoid arthritis joint nature. Usually at the early morning, patient feel the pain. So after the rest, more joint pain. After immobility, more pain. When patient get feel better with movement, opposite of osteoarthritis, right? So also prevent the flexion contracture. How to prevent? Provide the range of motion exercise. Apply heat and cold therapies. Applying paraffin bath, encouraging consistency with exercise program, because exercise motivates the patient, exercise improve the lifestyle. Use a joint protective device. Avoid weight bearing on inflamed joint. Very important. Every sentence is important for the board exam. And what next? Usually, self-care is important. Self-care, I said, assistive the device such as raise the toilet seat, self-rising chair, wheelchair can help and it is safe. Also work with RN and also occupational therapist can help them. Instruct the client in alternative strategy for providing activities of daily living. Fatigue is a common complication of rheumatoid arthritis. So fatigue, so you have to do something to reduce the fatigueness. So nursing intervention is important here, right? Nursing intervention means we have to tell your patient not to bending without a reason or not to weight lifting, weight bearing. Identify the factor that may contribute to fatigue. Monitor for the sign of anemia. If anybody are anemic, automatically they will get tired or fatigue. If anybody are anemic, we have to admit iron, folic acid, and vitamin, right? Iron is most important component of hemoglobin. Hemoglobin is the component of red blood cell. If you have enough red blood cell, that you can prevent anemia. Folic acid is important for maturation of red blood cell. Also, other vitamin like cyanocobalamin, vitamin C. Monitor for medication-related blood loss, right? Medication-related blood loss. We have to test the stool for occult blood test. Occult blood test, I said, right? So here also reinforce the instruction in measure to conserve the energy, right? So we have to encouraging to save the energy. So also it is important to educate your patient, right? Educate what should be included in the patient education. So client education for rheumatoid arthritis and other degenerative joint disease. It is important. I'm going to read with you. Assist the client to identify and correct safety hazard in home. So if you identify something danger, we have to remove. Instruct the client in the correct use of assistive device. So any helping device, it is any helping device or immobilizing device is very important of nursing care. If patient use any assisting device, we have to assess the neurovascular status every hour for first 24 hours after use. And do not lift or remove the weight. Do not let weight rest on the floor. Muscle spasm are expected and should be treated, right? So they said, instruct the client to sit in a chair. Client use only small pillow. Client in measure to protect the joint. Also regarding the prescription medication is important according as prescribed. So distracted body image. So if any patient has a rheumatoid arthritis nodule deformity, it is very important emotional issues, right? Because of the structural problem it is. So as I told you, we have to educate them about this. Determine the client reaction to the body image, encouraging the client to verbalize their feelings, assist the client with self-care activities and grooming, encourage the client to wear a steel cloth. So it is special type of cloth patient has to wear behind their shirt or t-shirt. Surgical intervention if need. Minimally invasive procedure may be prescribed, like synovectomies or arthrodesis or joint replacement is called arthroplasty, right? Very late stage. So osteoarthritis. Keep in mind, osteoarthritis and osteoporosis not same, right? Osteoarthritis or osteoporosis is not same. Osteoporosis means the rate of bone resorption, bone erosion is osteoporosis. But osteoarthritis is a degenerative disease process, degenerative, okay? And patient usually complain of pain and pain with movement or activities. And pain get better with rest. opposite of rheumatoid arthritis. Rheumatoid arthritis usually pain after rest or immobility and get better with movement. But osteoarthritis, pain with activity, get better with rest. Also, affect the specific joint in osteoarthritis, affect the specific joint, and not symmetrical. Means it doesn't necessary if your left knee get involved, right knee also will be involved. If both joint involved, it is called symmetrical. But if only one joint involved, is called asymmetrical or not symmetrical, right? And also we will be get negative rheumatoid factor. Whereas the rheumatoid arthritis, the rheumatoid factor would be positive. Okay, so osteoarthritis is marked by a progressive deterioration of articular cartilage. Articular cartilage. So it causes the formation of bony build-up and loss of articular cartilage in peripheral and axial joint. Osteoarthritis affect the weight-bearing joint, right? Such as hip joint, knee joint, or lower vertebral column. The cause of the primary osteoarthritis is not known. Risk factors include the trauma, aging, obesity, genetic change, and smoking. This is the risk factors. What else? What are the signs and symptoms of osteoarthritis? It is the degenerative joint disease, right? Degenerative. What are the signs and symptoms? So don't forget, as I told you, the osteoarthritis are progressive and degenerative. Articular cartilage getting involved. What are the risk factors actually for the disease? Osteoarthritis is most common in older age. Women is affected more than men. Obesity, smoking, and repetitive stress on joint. This is the risk factor of osteoarthritis. Okay, so here, as I told you, the data collection or symptom, sign of symptom of the disease are joint pain. Patient usually complain of joint pain, or they complain of crepitus in the joint, enlarge the joint nodule. Okay, so client experience pain most commonly. Disease is progressive. Symptoms are aggravated by temperature, right, or any climate humidity change. The two nodules are positive in case of osteoarthritis, whereas the rheumatoid arthritis, these two nodules not be positive. Okay, and also it is very important, we have to know the joint swelling crepitus make when movement of the joint make a sound, and difficulty to get up from prolonged sitting. Very common problem for the patient. So as a RN or LPN, what you have to tell your patient, or what are the nursing procedure, what we should tell, what should tell. Let's give a focus on this two picture. This is the normal knee. Okay, this is femur, this is tibia, and this is the articular joint. Tendon are joining two bones, and synovial fluid here, and synovial fluid is covered by synovial membrane, and ending portion of the long bone is called cartilage. So this cartilage get involved in osteoarthritis. Osteoarthritis cartilage involved. What next? Here showing the osteoarthritis, the disease process, the healthy joint, and this is osteoarthritis deformed, and this is the rheumatoid arthritis, right? So if I go little bit back, osteoarthritis, as I told you, it is a degenerative disease process, pain with activity, and get better with rest, and affects specific joint, not symptomatic, and negative rheumatoid factor, but positive Bouchard nodule. Where is the rheumatoid arthritis? This is inflammatory disease process. This is degenerative disease process. Pain also here, but pain after rest or immobility, and get better with movement. But this one get better with rest, opposite. Usually rheumatoid arthritis affect all joints and symmetrical, but they usually, rheumatoid osteoarthritis usually affect the heavy weight bearing joint and not symmetrical. And rheumatoid arthritis positive rheumatoid factor. So osteoarthritis continuation, I said data, muscle dysentropy, inability, and also compression of the spine. Pain is most common or both cases. If patient has a pain, we give them some pain medication, right? So pain medication with them, admin the medication as prescribed, such as acetaminophen, like Tylenol or topical application. If acetaminophen or topical agents do not relieve the pain, then go for NSAID, non-steroidal anti-inflammatory. Muscle relaxant may also be prescribed for muscle spasm, right? So here the treatment I said, in case of rheumatoid arthritis, we give aspirin, NSAID, steroid, and other immunosuppressive medication if need. Whereas the osteoarthritis, we give NSAID, muscle relaxant, or we as a RN or LPN, we educate them immobilization of the joint, cold compression, cold pack, and weight loss if patient are obese. So again, osteoarthritis, about the pain, how we have to take care of our patient. Okay, how we have to take care of our patient. Basically, osteoarthritis important. So basically, it prepare the client for corticosteroid injection if or as need or as prescribed. Position of the joint in functional position, immobilize the affected joint, avoid the large pillow under the head of the knee, head or knee, provide a bed or foot candle to keep the linen, and also reinforce the instruction on importance of moist heat, hot pack, or compress or paraffin dip. Apply the cold application as prescribed, encouraging adequate rest. Right? So, as I told you, the oral analgesic we give for pain, like acetaminophen or NSAID. If not okay, then we go for topical analgesic. Even sometimes we use the capsaicin or water gloves when applying, because when we use non-pharmacological, this can help to distract or divert them from the pain. And finally, I said injectable steroid, glucocorticoid, or hyaluronic acid. Nutrition is super important for the patient. If the patient has osteoarthritis, so encouraging a well-balanced diet and maintain weight within normal range to decrease stress on the joint. And physical mobilities, train, educate, reinforce your patient to balance activity with rest. Reinforce instruction that exercise should be active rather than passive, and reinforce instruction to limit exercise. And also go next, if patient is not cured by medical therapy, we have to go for surgical management. And what surgery? Total joint arthroplasty. Total joint arthroplasty, right? So again, I said arthroplasty, basic information. Arthroplasty means replacement of a diseased joint with a prosthetic joint. It's called arthroplasty. Basically, arthroplasty used for patient with osteoarthritis or rheumatoid arthritis or any kind of trauma or congenital defect. In case or sometime patient has a complaint of joint pain, crepitus, or swelling. Some of the condition arthroplasty are contraindicated. Example, current or recurrent infection or arterial insufficiency to affected joint, right? So basically, This is important about arthroplasty. What else? Now go the osteoporosis, another important disease in musculoskeletal system. Osteoporosis, right? Osteoporosis is a metabolic disease, metabolic, characterized by bone demineralization. Mineralization means if you give or eat equal distribution of calcium, phosphorus, magnesium. If you have a lackings of calcium, phosphorus, or magnesium, you develop erosion. If you have enough calcium, magnesium, or phosphorus, but they are not equally distributed to your bones will be broken. So not only enough or adequate mineral, also need to equal distribution. So osteoporosis is a metabolic disease characterized by bone demineralization with loss of calcium, phosphorus, or magnesium that lead to fragile bones, broken bones, erosion of the bones. Bone resorption accelerate as a bones formations, right? Osteoporosis occur most commonly in the wrist, hip, or vertebral column. Osteoporosis can occur postmenopausally. So when female does not produce enough estrogen, progesterone, most commonly chance of develop osteoporosis. The client may be asymptomatic until the bones become fragile and minor injuries or movement cause of pathological fracture. Okay, so what next? So this is the showing the normal bones. You see the density. The bones osteoporosis, there's so many vacuum inside the bones. So osteoporosis, I said the rate of bone resorption exceed the rate of bone formation in case of osteoporosis, and resulting in the low bones density and bones fragile. Osteopenia is a precursor of osteoporosis. Osteopenia. So what are the risk factor? What are the risk factors for osteoporosis? Risk factors are female gender. I said after menopause, some of the female hormone stop to produce and patient develop osteoporosis. So female gender. Then thin or lean body, menopause, insufficient calcium intake or vitamin D intake, smoking, alcohol abuse, excess caffeine causes osteoporosis, right? Lack of physical activities, hyperparathyroidism, long-term steroid use, long-term anticonvulsant use. This medication causes osteoporosis. What else? There are two types of osteoporosis, primary and secondary. The primary osteoporosis most often occur after postmenopausal women, and secondary occur prolonged medical treatment like steroid, corticosteroid therapies, or aluminum containing antacid or anticonvulsant. They causes secondary osteoporosis. What are the signs and symptoms of osteoporosis? The data collection, right? Usually, patients are complain of back pain or fracture, kyphosis, deviation of their curvature of the spine, or reduce the height. It is a complication. It is a sign and data collection for the patient. For sometimes asymptomatic back pain, and back pain that increase with palpation, or problem with balance, decrease the height, kyphosis, degeneration of the lower thorax, right? All of the sign symptoms. So as a nurse, what should be our intervention for them, right? Usually the test we do for osteoporosis, this one is called DXA, means dual X-ray absorptiometry. Usually the treatment, if you ask me what are the treatment we have to give the patient, we give calcitonin or estrogen if female, or we can give them some, disease modifying agent like alendronate, right? But most important for us, the teaching to the patient what it is. Get the sufficient calcium and vitamin. So tell your patient to take enough calcium or vitamin D. Moderate sun exposure using the sunscreen. Sun exposure is good to produce the vitamin D. Weight bearing exercise, home safety, prevention fall, and measure to preventing fall. So I'm going to read from here. Determine the risks for injuries. Also institute measure to prevent injury in the client personal environment. Assist the client to identify and correct the hazard in his or her position household items. Use the side rails. Reinforce the instruction to the use of assistive device. Encouraging use of firm matrix. What next? What are the other intervention for your patient? Provide personal care, right? Move the client gently, assist with ambulation, provide the range of motion exercise, apply the back brace, and provide the client instruction to promote optimal level of health and function. Also, encouraging or instruction to use of good body alignment, right? It's so important. Not only the patient, also for you, for us. So reinforce the instruction to avoid activity that can cause vertebral compression. Reinforce the instruction to eat a diet high in the protein, high in the calcium, high in the vitamin C and D, and also iron. Reinforce the instruction to avoid alcohol and caffeine. So alcohol abuse, excess caffeine intake, coffee, lead to osteoporosis. Reinforce the instruction to maintain an adequate fluid intake. Admin medication is prescribed to promote the bone strength and decrease the pain. Another most common disease we have to know, this is the gout, right? So gout, sometimes our board asks the question from gout. Let me continue the gout from here. So what is gout, right? Gout is a systemic disease. The systemic disease, and definitely they are affect the bones. Sometimes it's called gouty arthritis. So gout is a systemic disease in which the urate crystal deposit in the joint and other body tissue. Gout results from abnormal amount of uric acid in the body, and primary gout results from a disorder of the purine metabolism, disorder of the purine. And secondary gout involve excessive uric acid in the body or blood, right? Gout sometimes asymptomatic and sometimes acute exacerbation. So asymptomatic, the client has no symptom, but serum uric acid level elevated. And sometimes acute, client has exacerbation of pain, inflammation in a small joint, especially the big toes. You see gout, you see it's so big. In another phase, intermittent or chronic. What are the sign and symptom of the gout? Usually patient feel of swelling or inflammation in the joint lead to excruciating pain or trophy formation inside the joint. What is trophy? Hard, irregular shape nodules inside the skin containing deposit, low-grade fever, malaise, pruritus, or presence of renal stone. All are the sign and symptom of the gout. So basically, I said most of the times patient complain of the low-grade fever or swelling of the joint, like this picture, okay, pain or also renal stone. Elevated the uric acid level. If you check, you can get elevated the uric acid level should be elevated. If you check blood uric acid, it would be elevated, as I told you. So usually we have to decrease the purine in the diet for the patient. Okay, and treatment, basically we give them bed rest or heat or cold therapy. The special medicine we use for gout, this is called colchicine or allopurinol or probenecid. So what next? As a RN, what is our responsibility? What are the intervention, right? So intervention, provide a low purine diet as prescribed. Low purine diet. Food such as organ meat, wine, cheese should be avoided because they contain high purine. So purine we found in shellfish, liver, kidney, sweet bread, or sardine, right? This is the food contain the purine. And patient who have the gout, they has to avoid some bacon, or client can have some chocolate. Patient should increase the fluid 2 to 3 liter per day. And also you have to tell your patient for alkaline aids diet. Sometimes NCLEX board asks, what is alkaline aids diet? Including milk, fruits, most vegetables, small amount of beef or salmon, they are alkaline aids diet. Let me read it. Encouraging a high fluid intake around 2000 to 3000 milliliter or 2 liter to 3 liters. Encouraging weight reduced diet. Also instruct the client to avoid the alcohol. Encourage urinary pH check. Provide the bed rest. Monitor the joint range of motion exercise. And what else? Position of the client in mild extension, also during an acute attack. Protect the affected joint from excessive movement. Provide heat or cold, or admin medications such as analgesic, anti-inflammatory medication, right? More common medication we use for gout is called colchicine or allopurinol.